We're privileged to have with us today Dr. Ravish H, an accomplished medical professional and academician, currently serving as the assistant professor in the Department of Neurochemistry at NIMHANS, Bangalore. Dr. Ravish completed his MBBS and MD in biochemistry from MS Ramaya Medical College and has further specialized in community mental health for doctors through the NIMHANS Digital Academy. He has also undergone training in medical education technologies and is certified in laboratory management systems and quality standards. His professional journey includes working as a general practitioner, a consultant biochemist, and an assistant professor in biochemistry, giving him a rich blend of clinical and academic expertise. He has around 30 research publications, multiple research grants, including those on biomarkers, neuroinflammation, and stress biology, and continues to contribute significantly to the field of diagnostic medicine. With a special interest in biomarkers, laboratory diagnostics, and their applications in personalized medicine, Dr. Ravish brings valuable insights into how diagnostic laboratory tests play a crucial role in understanding, monitoring, and managing health conditions in the elderly. Today, he will be guiding us through the topic Diagnostic Laboratory Tests for the Elderly, highlighting their importance in early detection, disease monitoring, and promoting healthy aging. Please join with me in warmly welcoming Dr. Ravish. Sir, the
Yeah,
floor is all yours.
most welcome, doctor.
Thank you, sir.
As I told you earlier, we have been looking forward for this topic. We have been, in fact, requesting
Very good topic,
to post this topic for a long time. So they have now found a very beautiful, accomplished person to hold this. Welcome, doctor.
Thank you, sir. Thank you for the opportunity. I'll do my best and I'll try to answer as much as queries possible, sir.
Yes,
Sir,
doctor. You can switch on your video, doctor.
Yes, sir. Yes, sir. Thank you, sir.
Yeah.
Sir, my screen is visible, sir?
Yes, doctor. Yes, you are. You are.
Yes, sir. Yes, sir. Sir, today's topic is on diagnostic laboratory test for elderly person. So, as you can see, so an healthy person, when he undergoes a routine blood test and he discovers that there is an high levels of that analyte or a routine test, it definitely helps the person to take action and prevent avoid complication. That is how the diagnostics are very helpful in managing the case. So, for example, if you are walking in a garden in a park and there is a general blood sugar screening done, and you happen to find out that the sugars levels are very high. Till recently, you were not having any symptoms of diabetes, but you just happen to have a screening test and you found that the sugar levels are high. So most of the diseases won't have any symptoms. Okay, the symptoms will happen only later conditions, later days, not in the early stages. So in the early stages, the diagnostics tests are very helpful in identifying the case and also in treating them. Am I audible?
You are, doctor. You are. Fantastic.
Thank you, sir.
Absolutely no problem. Everything is pakka, doctor.
Yes, sir. So, as you can, because many illnesses in old age, like diabetes, cholesterol, and kidney diseases, they catch up in the old age. So they are their symptoms occur very late, but the analyte changes happens very early. So that is the need. That is the need of diagnostics. So all seniors should have a regular annual checkup, like a basic lab test, like blood sugar, kidney test, kidney function test, or liver function test. All these are small investigations where everyone has to undergo this annual checkup. Now recently, it is 40 plus actually. Nowadays they are going for 40 plus, not even 60 plus. As you can see in the slide, it is 60 plus. But here nowadays we are going for 40 plus and above. Yearly annual checkup is done. So many healthy people have a silent issues like high cholesterol, high blood sugars. All those things can be detected when you go for annual health checkup. So chronic conditions like there are some chronic conditions like diabetes, heart disease, kidney disease. These are chronic. Chronic means the disease won't kill you instantly. It is going to kill you over time. So these chronic conditions needs frequent monitoring. So it is required an advice from the doctor, because if you are frequently monitoring, you panic. So you require an doctor advice also when you are going for any diagnostic test. Okay. What are these common lab tests you can undergo? We have glucose. Glucose is the day-to-day fluctuation in glucose in the sugar levels. HbA1c is a 3-month sugar. Like you can estimate what was your diabetes stage during past 3 months. That is called as HbA1c or glycated hemoglobin. I think most of you are familiar with these words. Then we have kidney function test. So in the kidney function test, we have blood urea nitrogen, creatinine. These two are the function test. So this will tell the functioning of the kidney. So coming to the liver function test, we have something called ALT, AST, bilirubin. This panel will indicate the functioning of liver. So these two are very important, ALT and AST, which will give us the functioning of liver enzymes. Whenever the liver gets damaged, these enzymes and the analytes vary. It will increase. Coming to lipids, cholesterol is very important analyte because it is being implied in stroke and heart disease. So measuring the lipids like bad cholesterol, we have good cholesterol and bad cholesterol. So in good cholesterol, we have HDL. In bad cholesterol, we have LDL. So whenever we have the ratio of HDL and LDL, that gives the lipid levels in our body. So ideally, HDL should be more than 60 milligram per deciliter, and LDL should be less than 100 mg. So whenever the LDL reduces and HDL increases, there is a risk for the patient. So whenever HDL decreases and LDL increases, there is a risk for heart. Coming to thyroid nowadays, there is a lot of issues with the thyroid because we are using a lot of plastic compounds. There are polyphenols, and these polyphenols compounds, plasticizers, they are endocrine disruptive compounds. So these endocrine disruptive compounds are going to, they are like hit and run cases. They are just going to the axis, thyroid axis, it gets disturbed. So most of us, we have thyroid issues nowadays. Many people are getting tested with thyroid function test, especially TSH and T4. So TSH will indicate the how much the thyroid is getting stimulated by the deficiency, whereas T3 is the hormone level. So T3, T4 is the regular hormone level, whereas TSH is, if this T4 is reduced, the body will sense that T4 is low, and then it increases the TSH value so that thyroid will function more and it can secrete T4. If TSH is going on increasing and T4 is continuously falling down, that means the thyroid is not functioning well. So the symptoms of thyroid illnesses will occur very late, like fatigue, mood changes, and weight. All these things changes over many days, not in the immediately. Coming to vitamin B12, almost all of us, we have vitamin B12 deficiency because vitamin B12 is an hormone, which is a very, very important hormone. It is required for the many functioning in the body. So its absorption is affected by many factors. So vitamin B12, it is present in the animal origin food, not in the vegetarian diet. And this vitamin B12, even though you consume vitamins, it is not absorbed whenever there is a gut issues or gut problem. So the vitamin B12 are not absorbed. So we have to find out if the gut is not able to absorb, we have to give injections to compensate the vitamin B12. These are water soluble vitamins, vitamin B12 and all, and they get excreted daily. So it cannot store. If you take injection today, it is not going to store for years. So it is just temporary, maybe a week, that's all. If you are taking tablets for vitamin B12, you cannot discontinue after 2-3 months because they are water soluble vitamins. They are excreted in the urine. So you need to take continuously. So then coming to urine test, we have sugar test, proteins. This will indicate the functioning of the kidney. And there are some parameters like CRP and ESR. CRP is an inflammatory marker. I hope many people in India, they say cold, thandi and hot items and cold items. So this is related to CRP. If CRP is more, that is, it is eat agide. Some people say eat agide, cold agide, thandagagide. So this is nothing but inflammation. So CRP indicates that inflammation. So there was a one question like, is there any discount test in the online test packages? Is it reliable? There was a question asked recently to me. So actually, when you go with the discounted test price, they are not reliable. Okay, most of the labs, there are a lot of scam going around in the online. So you don't get trapped with that online schemes where they say there is a discount in the annual checkups and all, because there is a cost involved in running this test, this diagnostic test. They are not coming at cheaper rate. So reagents are involved, there is a quality controls are involved, and the authorized person has to verify the reports. All these costs are involved. If somebody is giving instead of 1,000 rupees, if he's giving for 100 rupees, don't go for it, because it is a scam. Because nowadays labs are being monitored. So whenever you are going for any test, laboratory test, always look at, is the lab NABL accredited? You look for the word NABL. NABL, if it is there in the report, NABL certified laboratory, then only it is reliable and the doctors can take action on those values, not otherwise. So you always have to see NABL accredited labs only. So if you are testing for any discounted prices, just check for NABL. Is it an NABL lab? If it is not an NABL, don't go for the test, because they are not reliable. So coming to this comprehensive metabolic panel. So in the comprehensive metabolic panel, it covers 14 analytes like glucose, electrolytes, calcium, proteins, liver function test, kidney function test. So it comprehensively, the metabolism in the body, it can be assessed using this panel, comprehensive metabolic panel. How it is been done? You have to prepare the patient for 8 to 12 hours before giving the samples. Water is allowed. They can drink water during fasting, that is 8 to 12 hours before. They have to fast for 10 hours. Water is allowed. They are not supposed to take any food. So if you are taking food and giving test, then your lipid levels will increase, the sugar levels will increase, and it will be a wrong metabolic panel. Okay. So now there was another question asked to me, is the abdominal scan is a part of this comprehensive metabolic panel? The answer is no, because scans are done only if the symptoms are there or if the doctor suspects the problem. So scans are not part of any metabolic profiling. Okay, they are not a part of scans. Abdominal scan, ultrasound scans and all are not part of the panel. Okay, so these are the few normal reference ranges. Most of you are aware of it. The creatinine should be less than 1 mg per in the men. 1.3 is for the men. Men has more muscles, so they have more creatinine compared to women. It is ideally less than 1 is better always. So sugars, most of you are aware of it. Normal sugar is 70 to 99. Pre-diabetic means less than 125. If it is always fasting sugar is more than 126, that means the person is having diabetes. So coming to liver function test, so it is always less than 40 international units per liter is the normal range for the liver enzymes. Coming to electrolytes, the sodium is 135 to 145, potassium less than 5. So these are some routine investigation reference values, because if you are aware of these reference values, you can only interpret your results. So calcium should be less than 10. It should be ideally 8 to 10. Between 8 and 10, it should be. Abnormal, if the electrolytes are abnormal, you will get the problems with the nerves, muscles, and the heart. So what are the fasting blood sugar is a current blood sugar, whereas glycated hemoglobin is a 2 to 3 months average blood sugar. So these two will help in finding out the status of diabetes and status of the kidney complication also as well. So what is this glycated hemoglobin? So glycated hemoglobin is a 3 months blood sugar. The sugar which is deposited on the RBC cells is measured using a technique called as HPLC method. So it is going to say the RBC cells are surviving for 3 months. So 3 months, how much amount of sugars is been deposited on the RBC cells? That is what is called as glycated hemoglobin. So the normally it should be 5.7%. Pre-diabetes it is between 5.7 to 6.4. If it is diabetes, 6.5%. So not only the fasting blood sugar which can indicate the blood sugar, it is also the glycated hemoglobin which will help us in screening diabetes. So coming to lipid profile, most of you have undergone this lipid profile. So there is terms called as cholesterol, LDL. As I said, LDL is a bad cholesterol. If the levels are more than 100, it is indicates that bad cholesterol accumulation is more. HDL is a very good cholesterol. These levels are important. If it is going up, it is good. If it is coming down, that means it is bad. If it is less than 20 or 30, if it is indicating 30, that means bad cholesterol is more and good cholesterol is reducing, and that will indicate for stroke and cardiac diseases. So why important? Because cardiac and stroke, these two markers are usually measured. So how we are getting this lipid profile done? By fasting for 9 to 12 hours before test, because it will influence, the cholesterol gets influenced with food. Frequency, I suggest yearly testing is important. So these are the normal reference ranges. For total cholesterol, it is less than 200 mg. For LDL, it is less than 100. As I said, LDL more than 50 is good for women. Actually, the LDL should be more than 50 for both men and women. So high risk, if the LDL is more than 160, that is very high risk for stroke and cardiac diseases. And if the HDL is very less than 20 or 30, that is an high risk for the cardiac or stroke related complications. By diet changes, exercise, and sometimes by using medicines like statins and all, it can improve your LDL. Coming to thyroid function test. So thyroid functions, as I said, a lot of endocrine disruptive compounds are there in the environment. They are going to interfere with our hormones, especially the thyroid hormones. Thyroid hormone is important for metabolism. So whenever this TSH increases, then it can cause for increase in weight gain and also a lot of other issues with metabolism. So thyroid function test is also very important nowadays. So normally the TSH range is 0.5 to 5 international units. High TSH means low thyroid function. As I said, low TSH means high thyroid function, hence that is hyper functioning of thyroid. So preparation, we need to fast the person, and better to get it tested in the morning hours, not in the afternoon time. Now coming to vitamin B12, vitamin B12 are very necessary for nerves and blood cells. So if vitamin B12 is less, then it can cause the pricking sensation in the pins and needle sensation in the fingers and the toes. And also if it is less, it can lead to anemia. It can lead to the memory issues. So vitamin B12 is been implicated in cognitive decline. If the levels are less, that means the cognition is going down, and your cognition or the memory issues can occur. So vitamin B12 normally it should be more than 200. Okay, if it is less than 200, then that is called as deficiency, and it can lead to problems like numbness in the fingers and needles and memory issues. And how to compensate? You have to take regular medications. Vitamin B12 supplementation is very important. After certain age, vitamin B12 absorption is very low. Better to take vitamins tablets after 60 years. Coming to vitamin D, this is very important. Whenever you are going for walking, better don't go very early morning, like 5 o'clock and all. You don't go because sun is not there. Better to go at 7:30 in the morning, because when you are exposed to that, and don't put all mufflers and full sweaters and all when you are walking. Better expose yourself to the sunlight when you are going for walking, so that you can synthesize adequate amount of vitamin B12, and this is needed for our bone health. And older adults, they suffer with bone related issues because of this problem. Whenever you are going for walking, better you wear half shirts or the t-shirts and better at 7:30, not in the early morning, like 5 o'clock and all. You don't go for walking 5 o'clock or 6 o'clock. Go for around 7:30. Okay, kidney function test, as most of the organs get dysfunctions over some time, so it is better to measure the kidney function test regularly, like blood urea nitrogen and creatinine. Creatinine should be less than 1 normally. If it is more than 1, that means there is a trouble in the kidney. So they also check for glomerular filtration rate. If the creatinine is very high, they go for GFR testing. So that is also been done in the kidney function test. So liver function test, as I said, livers also, all the organs get damaged or the functioning reduces over time. So in the liver function test, we have enzymes like ALT and AST and ALP. Bilirubin is there and proteins also estimated. These are the part of liver panel. So it detects the liver damage from the disease or due to medication use or alcohol. So over the age, once you get aged, the liver's functioning get reduced, either because of the aging or because of the medication or because of the alcohol. So you are always have to check for your livers along with the kidney function test. Preparation, you have to fast for 10 hours before giving test for liver function test for accurate results. Urine analysis, because most of the elderly they suffer from urine infection, so it is better to get urine tested. So when you give urine samples early morning, midstream urine is always preferred, and no fasting is required for urine analysis. You need not go for fasting. You just have to give midstream urine. Okay, so we are able to find out the proteins, glucose, and bacteria in the urine samples. So it indicates the urine infection, kidney disease, diabetes, and other conditions, other metabolic conditions can be detected through urine analysis. So bone health, so calcium and ALP, KLP is a part of liver function test. Calcium, as I said, serum calcium should be between 8 and 20 units. So this level will give us the normal calcium level. So vitamin D, as I said, better to go in the early morning around 7 o'clock when the sun is rising. You have to expose yourself to the vitamin for vitamin D synthesis through the skin. They do bone density scanning, so it is recommended for women with more than 65 years, and this checks the osteoporosis risk. So osteoporosis means weakness of the bone, and the bone get fractured if it is weak. So this bone density scan helps in that conditions. So CRP is an inflammatory marker. As I said, if you want to check the inflammation, we do CRP testing. So it is a general inflammatory marker. It is a general inflammatory. It won't specify which organ is inflammatory. It will just say it is a body is having some inflammation. So it is a protein made in the liver during inflammation, and it indicates infection, arthritis, and inflammation. If it is too much level, too high level, that means there is high inflammation going on in the body. That means we need to give some anti-inflammatory drugs to the patients. So it is a test routinely used nowadays. So interpreting the common test results, we compare the ranges, whether it is coming within the range or it is outside the range. So if it is coming within the range, nothing to worry. If it is coming below or high, then the doctors are taking the precautions to handle them by giving regular medications or giving advice for you to improve that value. They also see the trend from one value to another value. The previous reports, almost all, we have to keep our old reports with us because doctors are going to see the trends. The earlier reports are very important for them to understand what is the current status. So if you don't bring them the old reports, maybe a couple of last years or a few months back, whatever test you have done, if you don't bring them to them, they may have to get another investigation done after a couple of months. So you may land up in multiple investigations even though you had done earlier. So better whenever you take any blood test reports, better to save it in your WhatsApp only. You can save it. Okay, take the PDF and make your own WhatsApp group where you can store all your reports in the WhatsApp, and whenever doctors go for any consultation, you can show all this report so that they can see the trend. how the markers are improving or increasing. That is very important. So if you are using WhatsApp, better you can use to store all the results, whatever you getting tested in the WhatsApp, so that you can show it for the doctors to see the trend. So preparing for the lab test, you have to prepare for 8 to 10 hours. There should be no food. You can drink water. Water is allowed. Medication, ask if any medication should be stopped, because some medications are not interfering with your results. So better ask the concerned diagnosticians or or your doctors whether you can avoid some medications before you give test. Hydration is very important. Drink water unless restricted, because you have to have good amount of water. If you don't take good amount of water, the analytes might vary. So wear short sleeves, eat after fasting test. Okay, so after fasting, fasting is done, you have to eat some food. Many people, what they do is they want to get a good reading, so they avoid eating food after fasting sample, so that the postprandial will come in the range. So it is not recommended. Immediately after giving blood samples, fasting blood samples, better to have some food and then give postprandial. So preventive yearly, this comprehensive metabolic panel, CMP, HbA1c, vitamin D, and others are very important. Cholesterol is very important to be tested. Diabetes screening every after 45, every 3 years you have to get it done. Yearly for 65. Nowadays it is changed, like for 45 yearly they are doing. So thyroid every 1 or 2 years it is important for you to get it tested. So using lab results to guide treatment, like if you are taking statins, the high blood sugar lipid profile is important for you to get it tested. If you are on diabetes medicines, blood sugar monitoring is important. So you have to have a regular exercise. Whenever the high liver enzymes is there, you have to cut your alcohol or the non-veg food. Vitamin D supplements, whenever there is a low vitamin D, that indicates that you need to expose yourself to the sunlight. So all these precautions you can take whenever you get your lab test dead, and you can decide about your lifestyles. So chronic heart and hypertension, the lipid and thyroid issues are necessary. Thyroid is a very important disease nowadays. Every 6 months to 12 months, the testing is required. So for caregivers, what I can say is keep records. As I said, digitally you can save it all your records in the WhatsApp itself, and many results are shared online. Many patient reports nowadays, we are in NIMHANS, we are sending it on WhatsApp. Actually, all the reports are sent on WhatsApp. You can we can use that platform whenever you go for any diagnostic. Ask for whether the diagnostic center is giving a WhatsApp record, so it is very important for you. You can track those changes from one time to another time. Any abnormal results, please discuss with the doctor. Okay, don't take your own this thing actions. You always have to discuss the reports with the concerned doctor. Okay. So bring list of results for caregivers. What we can say is bring the list of results and medications, what they are taking. Encourage patient to share symptoms. Arrange for the interpreter to, if needed. If, for example, if you are staying in some other state, and you don't have any language barrier is there, better to take interpreter needed. And also always use simple language. Don't complicate things. You ask for simple terminologies you can learn and ask. Mobility difficult, so use mobile labs. Suppose if you have difficulty in traveling, always use mobile labs. And nowadays they take blood samples from you from the house only. So there is a house visit is there. Opt for it. Don't go to the lab. It is tedious for most of us. So better to take the test wherever there is home visit is there. Drink plenty of water. Very important. Fragile veins, because whenever there is veins are very important, very difficult to get veins while taking blood samples. So always take precaution to drink plenty of water, and you are better to indicate which veins they are. Many times which veins they can take blood samples. If you can suggest them this arm, and this place you can take the blood sample that will help you in getting multiple avoiding multiple pricks. So always don't go for any fear or for all those things. Bring loud ones with you to explain the things with you. There was also one question, are there blood markers for cognitive decline? Not yet. We don't have any blood markers for cognitive decline. We are doing research on this. We have few tests charted out. There are beta amyloid, newer tests are coming out. But there is a one marker which you can always rely on. Low vitamin B12 and thyroid levels can help you in finding out the cognitive decline. If you have a cognitive issues, always you can look for vitamin B12 and thyroid issues. But there is no marker as such for the cognitive decline. The cognitive decline, we don't have any marker for it. So these are the some precautions you can address. Drink plenty of water, like 6 to 8 cups daily. Is important to prevent dark urine. Test during the test day, drink water unless fasting is there. Okay, why? Because the water, when you consume a lot of water, it makes blood drawing easy. You can take the blood sample very easy. It avoids the collapse of the veins. Okay, it's important for us to drink plenty of water for testing. So routine test, they catch the hidden issues, guides the treatment. It also helps in discussing with the doctor. Okay, and always have a healthy habits. Stay proactive. Always get your tested blood tested routinely, and also these actions will keep your life longer and healthier. So these are the things what I can suggest you. Um, so there was also one question asked to me, are there any cost-effective cancer tests? Yes, there are some cost-effective cancer tests. There are stool tests for colon. There are mammography for breast cancer. There is HPV test for cervical and oral examination for mouth cancers. Most advanced scans are available for the detection of the uh, cancer conditions.
Dr. Ravish,
Sir.
can you listen to me?
Yes, sir. Yes, sir.
This is Dr. Mahesh Himadri from Abu.
Sir.
I wanted to just add a few tests in elderly, because elderly in majority, they complain of swelling in the legs. So in such cases, routinely all these tests are done. So there is another test which is called as NT-proBNP test.
Pro-BNP test, sir. Yes,
NT-proBNP test, which detects heart failure in advance.
Correct, sir. Correct.
And they, once it is diagnosed, then they can go for echo and other things. And second thing is mammography. You have to make it routine in your presentation that every 2 years, elderly females after 60, it is now recommended from even US recommendation for elderly screening. Every 2 years they have to undergo mammography, because as age progresses, the incidence of CA breast will increase.
Correct, sir. Correct. Correct, sir.
And so even I'll be happy even if you include total PSA test, total PSA.
Yes, sir. Yes, sir.
And for elderly, yes, and probably up to 75, up from 60 to 75 years, if it is done every 2 years, it will be, or every year also, it will be much beneficial.
Yes, sir. So these are all optional. As you said, it's a very good the suggestions what you said. But these are all kept as optional for our annual checkups.
And
all those things. Yeah. BNP, they are kept as an optional advanced testing.
Just to create an awareness, I just spoke to you.
Definitely.
And anemia is very common. So as you have mentioned about vitamin B12,
Sir.
it is better to mention even serum ferritin and serum iron test.
Correct, sir. Correct. So,
Because lack of iron is very common. Elderly, they don't get normal iron always. They have reduced iron and ferritin levels in their blood. So
correct, sir.
treating physicians will advise so many things to correct their iron and
Correct.
ferritin levels.
So that those investigations are done in the secondary stages. Preliminary, what we do is CBC. We do essentially we do complete blood checkup. So in the
And
complete blood checkup, we get an idea. The doctors will get an idea about the status. So based on that report, they are going to ask for ferritin and other tests because these
uh,
tests are very expensive. And the comprehensively, what we do is we do some basic screening tests initially, and then based on those reports, the doctor will take a call whether to go for an advanced test like ferritin and all. But usually, the to catch the hidden issues, these comprehensive blood test like complete blood checkup, the complete metabolic panel, lipid profile, RFT, LFT, all these basic things we are going to give a direction where to go for what to next level investigation is possible.
and another thing is, see, in cardio metabolic risk factor, CRP is in a general marker, but what is most important is HSCRP.
HSCRP is more important, eye
Yes.
sensitive CRP. But eye sensitive here again, the CRP, what we do is it's a screening test again. So if
Okay.
the CRP is coming negative, then if the doctors think that okay, we need an HSCRP now because it is an eye sensitive CRP. So
Because anyone when you are screening for lipid profile, if you just, I'm just telling, if you include HSCRP, it will be much better to evaluate and treat patients.
100%, sir. Because
Hmm.
HSCRP, because again, the CRP is a routine investigation to go with.
Hmm.
The CRP, the cost is very less. HSCRP, the cost is more. So initially, what we do is we do a screening test. If the CRP is negative and the person is having some history, clinical history is there, examinations are there, examination findings are there, then they go for HSCRP to do a specific sensitive marker. So it is going to HSCRP is going to detect the smallest change in the inflammation. Whereas
And what is, so sir, another thing is, whenever you have listed so many investigations, what is important is to mention peripheral smear study,
yes,
and that will give you a lot of picture, because blood disorders are very common in elderly, na?
correct, sir. Correct, sir. Correct, sir. So all these are done in our investigation in our NIMHANS. We run lot of programs for seniors, sir. There is a geriatric clinic. There is a memory clinic. We have normal seniors who can get cognitive. Normal seniors can also come to us, and we are going to analyze their cognitive assessment and health for free. So these are options which are available in NIMHANS. So in NIMHANS, we have all this option. In daily we are running around 2000 tests per day. Per day 200, around 800 samples we are analyzing, to 2000 tests we are running. So a lot of programs are running in our NIMHANS also for seniors. I welcome all the seniors to come to us so that we can effectively analyze the symptoms preliminarily and give advice, sir.
Okay, great. It's a great thing. Thank you very much. Thank you.
Good evening, Dr.
Good.
Ravish, Mahesh, doctor. Good
Yes,
evening,
yes, sir.
doctor.
Good
Yeah,
evening, sir.
this is Jammunathan. Doctor, see, in fact, I give you a brief introduction about Dr. Mahesh. Mahesh is a geriatric specialist. He is working as the head of the department of a hospital at, Rajasthan, Abu Dhabi. What is that place, Dr. Abi?
Yeah, Mount Abu, Rajasthan.
Mount Abu, Rajasthan. So he is there, and he is a regular contributor for us. In fact, I think he has undergone some training in NIMHANS also. And he has been he has also done some programs with us, doctor, in the past. And he has been very actively contributing in all our webinars, doctor. So I'm very happy, doctor, that you have come out. But before, we go to the general questions, doctor, can you talk something about this? They are talking about loss of muscles, etc., etc. So can you just think of some tests or something like that to find out how much the muscles are lost? What can be done to ensure that the muscles are lost, not completely lost? See, this is the topic that is going on and on and on in the various. I mean, because we also go through this. I mean, this WhatsApp forwards and some. I mean, some of the programs also we talk about this muscle mass. Can you do?
Yes, sir.
Can you help us
Sir,
about something
we
on that?
have one creatinine kinase test for it. So
Uh-huh.
creatinine kinase to
Uh,
see the muscle the related issues. Uh,
hmm.
and overall, the point is these markers, whatever biomarkers, what we are talking about, most of them they overlap on one symptoms to another symptoms. If there is a muscle and bone disease, it will be overlapped with that. And also clinicians are very good in identifying which organ or which tissue is getting affected. So it is very difficult for us to say a single test is possible for each of these. So we can get it tested, but again we have to rely on the clinicians to interpret it and to give advice. So there the clinicians roles plays a very important role in deciding which test to be asked for the elderly seniors, because the lot of tests are there, lot of investigations are there, but nobody nothing is gold standard. All are screening or confirmatory with the clinicians input. So I suggest to always to go with the clinicians support only for all the tests till now we have till we have a gold standard test for all these things. So we have some tests like creatinine kinase, all those things, but they are not standard test to say that there is a muscle injury, sir.
Muscle injury as such. Therefore, that nothing can be decided. Therefore, it is better to ask our doctors about that.
Yes, sir. Yes, sir. They are the best
They
persons
are
to
the best to,
guide you.
yes. See, in fact, doctor, because of the lots of advertisement coming about in these, I mean, in various forums, people are nowadays deciding by themselves whether I can do this test or that test or something like that, and they get a report, and they really do not know how to interpret that. So
Yes, sir.
based
Yes,
on
sir.
some ranges, they themselves interpret and they come to conclusion. I would I mean, I would like you to state whether this is right or if this needs to be corrected, doctor.
Yes, sir. So another thing, what is happening nowadays days, the doctors are becoming like helpline consultants. So many ways, what they do is they don't go for regular consultation. They get a report and they just send it to known doctor to interpret that. So what happens is nowadays all the doctors are getting specialized in one area or the other. So for example, myself, I am looking after the diagnostic. My role will be like whether this marker is tested correctly or not, whether the reports are okay, whether the analyzer is giving correct measurement or not, like that. But as the doctors are getting specialized in one domain or the other, you cannot send the reports to a known doctor and ask him to interpret it, because most of the time they are not aware of it, how to interpret that. So better to always stick on to the general practitioners. What we are 20 years or 10 years back or 15 years back, we had family physicians, we had a basic MBBS doctor who knows everything about the general body. So better to stick on to the basic consultation and ask their support, instead of sending it to randomly to some doctors for interpreting the results. The doctors also not aware of how to help you most of the times.
Oh, thank you, doctor. That helps. Therefore, I think that the general advice is that please stick on to one doctor, go to your
Yes, yes, sir. Definitely that will
without,
help, sir.
yes.
So
And
maybe you may have to give some consultation fees, but most of the doctors they don't even charge more than 500 or 1,000 rupees. But it is worth for you to consult a doctor for all the interpretation and for suggesting what test to be get done, rather than deciding ourselves and getting tested and sending the reports to the some doctors who we know, because they also are helpless. They cannot interpret properly.
yes, doctor, that's right. Thank you, doctor. Thank you for that advice. And incidentally, doctor, I wanted to talk to you about the PSA levels.
Yes, sir. Yes, sir.
Yes, sir. See, these PSA levels, I think nowadays they are talking about two things: PSO profile and the PSA level. What are they? I mean, is there any difference between what is this PSA profile? Any
Yeah, that
idea,
is
doctor?
the prostate specific antigen. So nowadays, what is happening is, even for vitamin B12, we have active vitamin B12. Just like
Oh,
that PSA, we have another active form of the antigen which they are measuring. So these are newer tests which are coming up, and most of those tests are not so validated and not clinically available. Still a lot of discussions are going on what to use. Vitamin B12 only, there is now they say active vitamin B12. Vitamin D, if you ask, they will say active vitamin D. So calcium, you say they will ask different calcium. So lot of newer things are coming up and still are there in research actually. Nothing is confirmatory. Still, what I can suggest is you have to stick on to the doctor and take his advice rather than opting for newer test. Newer test is not validated, sir, everywhere.
Oh, thank you, doctor. That helps
Not
because
to
again,
get confused with a newer test. Newer tests are still under research. Still, we are evaluating that clinically whether it is useful or not. So once if it is useful, then it will be available everywhere, and you will be able to understand that better. So not to take a role of a doctor to diagnose with newer test. Newer tests are still under research, and lot of confounding factors will influence all these tests. No, there will be a lot of confounding factors. So the either age, either BMI, either gender, or some other medications, they all influence these markers. So for one person it might be useful, for another person it is giving a wrong information. So it is not correct for us to decide with some health reports or some magazine reports and get it tested and take a decision. So better to rely on the consultant only for to decide what is good for us.
thank you, doctor. That helps a lot because there's lots of mystery surrounding around this blood tests and these things like that. I
Yes,
think
sir.
that was the reason why we have been looking for this topic, doctor.
Thank
So
you, sir.
thank you, doctor. I know that NIMHANS is perhaps having one of the best biochemical laboratory in the country.
Correct, sir. Best
And
in the world.
perhaps the best biochemical laboratory, and getting somebody from NIMHANS to talk about this something great. So
Thank you
thank
so
you
much,
very
sir.
much, doctor. Thank you very much. I think most of us, most of the doubts have been cleared now. Now I'm just opening it up for the discussion with people. Ramnath, you wanted to ask any question?
So these are my acknowledgements, sir. I would like to take an opportunity to acknowledge my head of the department, Dr. Sharda Madam, and our quality coordinator, Dr. Nandakumar sir, and also our HOD, Dr. Srinivas Bharat sir, and Geriatric Secretary, Dr. Vijay Arbishettar sir, for guiding me constantly in this campus, sir.
Thank you, doctor. See, in fact, I had the good fortune of meeting Dr. Nandakumar about a week back in a meeting. See,
Oh, very good, sir.
we had a dinner meeting. There I had the good opportunity. I think he is from Jipmar, Banglaore, Jipmar,
Yes,
Pondicherry.
yes, sir.
And he had his education at Jipmar, Pondicherry.
He has a very good this thing in the quality. Is our NABH coordinator. He is
Yes,
working
doctor.
very
Yes.
hard to bring quality things in our institute and in our campus. He has helped us in getting best in the world. Best, our lab is best in the world actually. Best hundreds. It comes in best 100
Yes,
labs
doctor.
in the world.
Yes,
So
doctor. I think
Dr.
Dr.
Ravi, Dr.
sir,
Ravish, just I wanted to share a suggestion that if you include serum magnesium in the elderly package, it will be much better, Bhaiji.
yes, sir. Yes, sir. Definitely,
See,
I put this word to our senior faculties, Sharda Madam,
yes.
Nandakumar sir.
Ah,
So definitely we'll try to bring it, sir.
okay, thank you very much.
Sir, what is that you said? That serum magnesium.
Serum.
Serum magnesium.
Magnesium. Oh.
Yeah.
Sure, sir. We'll definitely will discuss with sir and madam, sir.
Yeah.
Dr. Ravish, very good evening. Lekha Shivshankar here. You had
Good evening.
mentioned a particular test with regard to a heart checkup to know how strong the heart is. So,
Yes.
how?
Ma'am, actually, the thing is when the cardiac markers, there are promising markers actually. Troponin is there, CKMB is there, lactate dehydrogenase. So many markers are there. But the problem with these markers is they are not fully 100% sure. So they have a lot of limitations again. So the clinicians, cardiologists, they always rely on the ultrasound scans and the treadmill along with our biochemistry markers. So nothing is totally 100% confirmatory. So though the trop T and all, it is giving a good measurement. but still it is better to discuss with the cardiologist and let the cardiologist decide. And most of the time we have to look for the good cardiologist also. So I suggest Jaydeva like institutions, they are very good platform. We are very fortunate that in Bangalore we have Jaydeva like institutes and all. So better to approach those centers who have a lot of confidence for the general public and take their advice, ma'am. Because the troponin T is there for cardiac measurement, but still it is not so gold standard like measurement.
Thank you, doctor. Thank you so much.
Thank you.
Doctor is now talking about all those tests that are very gold standard. Yes, these are all very essential. Therefore, that will give us lots of information. And I think all other add-ons can be decided by the attending physician.
Correct, sir. Correct.
So it's better that we consult our doctor before going in for this.
100%, sir. 100%.
Yeah.
That's the best way, sir.
Yeah, that is the best thing, doctor. Thank you, doctor. Thanks for reiterating this advice. We have been repeatedly telling that we need not have to be our own physicians.
Correct, sir. Correct, sir. Because even doctors are researchers, they will be doing a lot of research on these markers and they will be having a first-hand information about how these markers are performing. So if you go there, then definitely they will be giving a correct predictions and correct management for you, rather than taking decisions on ourselves, sir.
Yes, doctor. That's nice, doctor. That's again reiterating that it's very important, doctor. Thank you.
Thank you, sir. Thank you, sir.
May I ask a question, doctor?
Please go ahead.
I'm Vasudevan here from Malaysia, from Bangalore.
Yes, doctor.
I got a doubt. If a blood sample is taken today in the morning,
Sir.
how does it give an average for the last 3 months? Average, as we understand, we got to have multiple values, take the number of readings and divide by the number of readings to get an average. If we take one sample today, how does it give a value for 3 months?
Yes, sir. A very good question, sir, actually. So I am also from Malleshwaram, sir. I stay near Rajajinagar, Gayatri Nagar, Rajajinagar, Subramani Nagar, sir. Happy to know about you, sir. The thing is, there is something called as RBC, sir. RBC cells, they survive for 3 months. So in terms of glycated hemoglobin, the sugar molecules, they get deposited on this RBC cells. So when we measure the sugar molecules present, which is deposited on the RBC cell, we can estimate that, okay, for 3 months, this was the value. Only few measurements we can do that, sir. So not all the measurements, so only few measurements like glycated hemoglobin. I'm also working on hair biomarkers, hairs and nail biomarkers, where hairs grow at 1 centimeter per month. So we can estimate the chronic stress over a month or a 3 months duration. If you take 3 centimeter hair sample, we can estimate the cortisol level in that and say that the person is having this much stress over the 3 months. Like that, we have only few parameters where we can test the 3 months duration, not all the parameters, sir.
Now, I have got another question which may sound very primitive compared to the advanced technology we have with all the computerized value and calculations, etc. How accurate are these results compared to the old methods of titration?
So these methods are very good, sir. Actually, the current standards is very good, and we have a very with a lot of confidence we can say the values, because nowadays what we are using is the most advanced techniques like chemiluminescence, electrochemiluminescence methods and all we are using, unlike the photometer methods, and the quality controls are being improved a lot. We are checking in our NIMHANS only 3 times. We are checking the quality of the instrument morning, in the afternoon, in the night. So all the round the clock they will be quality tested before giving the results. And also these methods are very sensitive. They can measure the very accurately. So these measures are very accurate, sir. But still, there is a confounding factors and the pre-analytical things which will influence these markers. Pre-analytical means the blood samples before testing. So most of us, we won't be fasting for 8 to 10 hours. We are taking a lot of medications. We are taking a lot of lifestyle modifications are there influencing this. And also most of the times the blood sample what they draw, it gets hemolyzed. That is the RBC cells, they break up. And these hemolyzed samples and all, they interfere with the results, and even the analytics is very good, but if you pre-analytic and the errors are there, then definitely your results get affected, sir. So that I can say. Pre-analytical, we need to address. Still, there are a lot of gaps in there. So we need to address the pre-analytical and the confounding factors. So other confounding factors, we need to control that to give a proper measurement. Analytically, it is good, sir.
But you said in NIMHANS laboratory, they do very well. All the NABL certified labs adopt the same procedure, or they are
Yes, sir. Yes, sir. Yes, sir.
reliable?
Yes, sir. All the NABL laboratories, they adopt the same standard methods. They have been audited every now and then. Yearly, they will be audited by the peer members from the other labs. They will be allowed to see their QCs. They will be questioned. We are going to give. Suppose I am an NABL qualified authorized NABL auditor. I will be asked to check up the other labs. So I will be going as an auditor and I will be checking their QCs. I'll be checking all their processes and I'm going to give non-conformity or NCs to them, and they are going to correct themselves. So it is a improvement programs. Every now and then we are improving the labs by checking each other. So this NABL is having this methodology or guidelines that is improving our quality, sir.
And one last question.
Sir.
On one particular day, if I give samples to two different NABL laboratories, do they get the same sort of results, or do you expect the same thing or no?
Sir, I can assure you that it will be near to the comparable results. I can assure you, but there will be methods will be divided.
Okay, thank you.
Thank you,
Sir, see, in fact, I would like to add something on this, sir. In fact, if you are getting a wrong value in a NABL approved lab,
sir.
then you can always show it to them. See, on the same day I have done this test in this lab, I have got this result, and your lab has shown this result. Which one is correct? And they are obliged to redo your test, sir.
Yes, sir. Yes, sir.
I think one thing, and secondly, I think, sir, it is well within our rights to suspect something. That is, I don't deny that. But one thing is that we also need to develop confidence, because having worked in this field for some time, especially this lab test, and this NABL accreditation in this area, I am 100% sure, sir, this is perhaps the best that is possible by the government.
Correct.
The best, certain times even the best may not be adequate, but this is perhaps the best. And I'm coming back to one old question of yours, sir, regarding this. How the 3 months average can be found out. Sir, see, I tell you, God has given so much of good quality to the blood. Blood
Yes.
can remember.
Correct, sir.
That is a very important thing to understand it in a layman language like you and me. Blood can remember, and blood is remembering. And perhaps the best value to determine whether a person is diabetic or not is perhaps this test.
Okay.
Isn't it? The one thing. Doctor, only one last question before others ask. Is that, does the value depend on the age also, doctor?
Correct, sir. Values depend on the age. So as we get older, all the organelles and all our tissues, they get degenerated. So it will be functioning very lesser compared to the younger age. So younger age will have a different values and the older age will have a different values. And as they get older, the values keep changing because they will be having multiple issues and there will be lot of medications as well. So this will influence the analytes. So definitely there will be it is better to compare your own results, previous results, and the current results rather than comparing your result with another person. Because personalized approach is the best way of handling the healthcare rather than comparing your results with others' results.
Thank you, doctor.
So for you, it will be one particular value which is normal. For others, it will, for example, sugar. For you, it is 180 is your normal sugar. For others, it will be like 200, 250. So they cannot compare your sugar values with another person. So it will be different.
Thank you, doctor. Thank you.
Dr. Ravish,
Sir.
Dr. Ravish, do your lab does anti-aging marker like serotonins and telomere length evaluation? Do you do that?
No, sir. No, sir. No, sir.
For research purpose, just
research purpose, no, sir. We are not doing that. Even in research, we are opting for air biomarkers to see the aging markers. No, sir. No, we are not doing. Sir.
Okay, Ramnath. Sir. Ramnath, you are trying to ask some question. Please unmute yourself. Ramnath, yeah, please unmute. You are not unmuting yourself. You are trying to do for a long time.
Hello.
Yeah,
Okay.
tell me. Okay, ask.
Hello. Okay.
Yeah, okay.
Hi, sir.
Sir, sir, I was in the hospital for 1 week last week because of this viral fever and all these things. First day they diagnosed as dengue, and the third day they diagnosed as malaria, and the fourth day they diagnosed as some another influenza, some viral fever. Then again, lot of had taken a lot of tests and taken blood in both the hands. There's no vein is found. And once my ICU madam came and then near the wrist, they have found the vein and take the blood. So that is a case for me. I am 17 years old, ex-bank employee. So I had a result, sir. Just to read out. Please check
Sir.
up. Generally, less only. This is hemoglobin 13.5 out of 13, 17, and
Correct.
4.43 at the packed cell volume. Then the 5.4 red count the whole blood EDTA, and then 80 for NCV, MCV. The platelet count is less than 65,000 out of 1,50,000. And the monocytes 10.3 stop 2.16. So, lot of variations are there in certain areas. Okay.
Sir, generally, what I can come up with the values what you read, the HB hemoglobin is fine, sir. Nothing to worry. So
Okay.
the other things are also not so low or high. It is
I am worried about the platelets. Anyway, I came home yesterday
Sir,
night.
platelets, what
65,000.
happens, sometimes you have to retest it again with some other lab because
Okay.
when the analyzer is
No,
looking,
my question is, if a platelet is less, so anything happen in future or any
it will
unwanted thing
recover,
will
sir.
happen?
It will recover, sir. As the sir, platelets will
It was
recover.
very less previously. One day it was 112, second day 62, like that only. That's why I'm worried.
Not to
Okay.
worry, sir. It will improve. It will over the time. It will recover. So only thing is you
They
test
have given
again.
vitamin tablets and D12 and B12 also high. I
Very
have not stopped that Nirobion for my leg injuries.
good, sir. Neurobion water soluble vitamins. This vitamin
Then I
water
have the
soluble.
sodium issues there, very less. So it is only 132 out of 135.
Sir,
But
132 is fine, sir.
drinking water
132 is
has
fine.
2 liters a day. Is it very high?
132 is fine, sir. Sodium
Fine.
is 132 is fine.
Okay.
Not to worry. Not to worry, sir. If it is 120 or if it is less than 125, it is we have to look after. But
Previously it was only
132 is
120.
fine.
The last month is only 122. I am taking that Stata tablet, 7.5 mg alternate day, and it is okay. Okay.
Yes,
Thank you,
sir.
sir.
Yeah.
Yes, sir.
We'll just stop on this. So,
Thank you very much, sir.
Thank you, sir. Thank you, sir.
thank you, doctor. Thank you. Any other person has got any other question? Doctor, I mean, we have not spoken anything about blood pressure, doctor.
Yes, sir.
Very common one. Very common one. See, in
Yes, sir.
fact, there is a question on that. I mean, some lady has asked, what is the best level for I mean, BP for a 65-year-old person or something like that? I mean, can you just throw some light on that, doctor?
Sir, actually, during my MD dissertation, we have to do a project on during our MD. I took essential hypertension biomarkers. There is no biomarker for hypertension actually. So I do take this research. So I estimated this markers, essential hypertension biomarkers, and I can give you some ideas like fibrinogen, D dimer, all these things. They are able to say an estimation of essential hypertension, but there is no definitive marker for hypertension. Blood test is not there. So there is one D-dimer marker is there. CRP is also there, but all these things are not used for hypertension, sir. Hypertension, again, it is the sphygma manometer what we are using. The BP apparatus what we are using is a standard for us. So we
Yes,
don't
sir.
have any blood test for the essential
That is
hypertension.
right, doctor. That I understand. But what would be the best numbers, doctor? See, because I mean, even some time back, about 15 days back, they said that American Heart Association has again said 130/80 is the gold standard. So we don't want to change it, etc., etc. But at least in India, we have been talking about that. This based on our age, the blood, I think the blood pressure can increase or decrease or something like that. So this is very confusing, doctor. So
Yes, sir. I will tell you, sir. Sir,
please.
actually, what happens no for the most of the research, what we follow is the Western population. The Western population have the different parameters, different reading. We cannot adapt to their values and say ourselves we are having hypertension. So, and most of the drug companies, they try to reduce the values. Instead of 140/90, they will say 125 is high. So it is always wrong actually. For each, I personally feel that each person has their unique biology and unique the blood levels or reference levels. So we have to go with the clinicians, whoever is taking care, a consultant. They will know that this is your regular blood pressure value, even if it is high for the others. For example, if you are getting 150/90, that might be a normal reference for you. The clinician or a consultation over the time, when he is seeing you all the time, he will come to know that this is a reference for you, and that is how the practice they do. But what is happening nowadays is because of the specializations, and people are running around with the doctors, new doctors. We are not able to get a proper healthcare management. It is again family physicians or family doctors who can help us and who can really take care of us well, rather than going around with all the doctors in the Bangalore.
Thank you, doctor. Thank you, doctor, for reiterating that old family doctor concept. Thank you for that. And it is better that we go to the same person again
Yes,
and
sir.
again. Yeah, I mean, let us not decide the doctor. I mean, let me not decide whether my doctor is good or bad. I will
Correct, sir.
assume
Correct,
my
sir.
doctor is good. I
So
will
once
always say
they keep
that.
seeing you, they will know that this is the normal for you. Even the worst doctor will come to know, okay, yes, seen for couple of years, he will know that this is normal for you. That family practice or family physician concept has to come back to us again. Then only we can help each other, sir, actually.
Doctor, with so much of specialization by the day, I
Yes,
think
sir.
these family physicians are say a tribe that they are not existing nowadays at all.
Not existing only, sir.
That
That's
is
the
very
problem we have created.
that is one major problem that especially we seniors face, doctor.
That is the major problem, sir, actually.
That's a major problem, doctor. Thank you very much.
Yes.
Thank you. I mean, time is already up. I know you are a very busy doctor.
Thank you, sir.
So yeah, thank you. I mean, madam.
Yes, sir.
Yeah, you can try to. If there is no other question, I think we can close down.
Jambunathan, I have a question.
Yes, sir. Yes, sir. Please come, sir. Please come. Please ask.
Doctor, my name is Nagaraj Rao. I'm
Hi, sir.
88 years young.
Yeah,
And I
very
do
nice.
not have any problems of BP or sugar.
Wonderful, sir. Wonderful.
I'm a follower of yoga.
Oh, very
But
good, sir.
of all the tests, is there any test to measure the stress level in a human?
Yes, sir. That is what we are exploring since COVID-19. I started exploring this hair biome or keratin tissues. We have nails and hair samples. I am exploring that, and we are finding promising results. We are able to measure the stress level using our keratin tissues. The problem is with the hair sample is some of the male people, they don't have hair samples. The posterior vertex of the scalp we need to take. So for them, we are trying to go for nail samples. For the person who is not having hair samples, we are trying with nail samples. So we are exploring that, and we are getting good results about that. And we can measure. You can send your samples. We can measure how much stressed you are in the 3 months duration based on the samples you get. So if you are getting a 3 centimeter hair sample, we are going to give you a 3 months stress level. So if you are giving 6 centimeter, we can measure 6 centimeter, 6 months time, how much stress you had experienced. we can do that.
But the records I have gone through, stress is the main factor for all the ailments, most of the ailments
Correct,
in the
sir.
human.
Correct.
So that becomes the basic test, which was not mentioned. That's why I wanted to bring.
Now we are developing, sir. We are developing it, and in the sooner, in another couple of years, we'll be having that in the diagnostics also.
Second, my experience in one of the hospitals, I don't want to name them. My
Sir.
wife was having the problem of sodium. We took
Sir.
her for test, and then she had a varicose problem also. The first test indicated that she had 340 level of sodium, and the
340
that was the indication that was
blood,
given to
sir.
us in writing.
Blood sample.
Secondly, the
Blood sample.
platelet level was 20,000. 1 week ago, I had got it tested. The sodium level was 130, and the
Okay.
platelet level was about 2,40,000.
Hmm.
Immediately, I went to the doctor and challenged him.
Hmm.
I know something about it, not much. I'm not a doctor, but do you think you expect a person having 300 to live,
No, sir.
walk like this?
No, sir. It is not
Im-
possible.
Immediately, they got the second test done, and it came down to 134.
Yes, sir. Sir,
And
I
platelet level was 2,10,000.
yes,
In
sir.
the meantime, a suggestion was made that we have to transplant platelets. So
Ayyo.
this is the exploitation of the hospitals
Hmm.
where you go for testing. I think, as you
Correct.
suggested, doctor, good NABL test, lab would be able to give
NABL
some
accredited
feedback.
labs alone are the best.
Yes, sir. I would like to thanks for this information. I again want to validate that we have a very well established NABL labs in our Bangalore. Again, for senior peoples, we have in our NIMHANS good programs running. So better you always test it in NIMHANS only, because NIMHANS has a good facilities here. Instead of giving samples some other place, better to give it in the NIMHANS, because NIMHANS has a good NABL facilities, and you get a reliable results. So instead of giving for a public institute, it's a better way rather than going for a private institute. We have the tendency to give it for private institutes for our test for healthcare. I would like to re-emphasize that in Bangalore we have a world-class institutes like NIMHANS, Jaideva. All these are government institutes. They are very well developed actually by the administrators. So better to utilize those facilities rather than going for private.
Sorry, doctor, for interference. It was not meant for blood testing. It was she was admitted for something else, and in the
Okay.
course of this discussion, this one, for about 3-4 days, they did all these tests, and
Hmm.
these tests, of course, I have to make a mention so that people are cautious about this. This is Manipal Hospital in
Hmm.
Old Airport Road.
That is the thing, sir.
It's a very bad and very irregular this thing, to go to the hospital. We never went for blood testing. We went for something else. And
Hmm.
in the course of that, the blood testing was done, and this was the result, which was revised, and I took it even to the press.
Ayyo. So I want to again tell and request you people, sir, actually to put a pressure on government to strengthen the public hospitals, public center health centers more and more, so that we get in turn benefited. All of us will get benefited. So like Bangalore Medical College, now we have to improve that facility. NIMHANS has been improving. Jaideva is improving. We need to put most of our efforts in the government hospitals. Most of us middle class and upper middle class, they don't even go for government hospitals for their blood checkup. They think that they don't do well, but it is wrong. Actually, they are doing very well. They have well established labs. They are striving hard to give service. They have NABL in them. But we don't market saying that we are NABL, but we are NABL labs and we are best in the world. So I would like to request all of you to utilize NIMHANS facilities. NIMHANS is running lot of programs for seniors, so they can utilize those facilities, sir.
Sure, for last 15 years, I have been with on the diagnostics,
Hmm.
and then they give a correct answer, and then in case there is a variation, immediately they call us and inform us.
Very good, sir.
The
Very good.
sodium was one of these issues that was called and informed. Then the nearest hospital was Manipal. We had to go there. They had nothing else. No.
Yes, sir.
Thank you, doctor.
Thank you, sir. Thank you, sir.
Thank you, sir. Madam, you can close down.
Thank you, sir.
Yeah.
Thank you, sir, for this
Thank you so much.
enriching presentation. I feel this was very interactive. A lot of doubts were cleared, and I think this was very informative too. And we all have takeaway message from this presentation. So thank you, sir, for your time and
Thank you.
putting
Thank
in
you.
so much effort into the presentation and explaining the doubts very patiently. So thank you, sir. We were privileged to have you with us.
Thank you so much,
Yeah.
madam. Thank you for an opportunity. It was my privilege, and it was my. I'm very happy to share these things. And if again, if is a requirement, I'm happy to contribute. So we are here at NIMHANS, and we will be helping you. Whatever doubts is you are having, whatever confusion is you are facing day to day, lot of information of flow is there. So I can understand. So always I will reiterate that better to rely on one doctor whom you trust and believe them, and rather than circulating your reports across the WhatsApp groups and asking for their suggestions, because most of the doctors, they don't know how to interpret, because they have specialized in one area, they know about that area, but they cannot understand the other areas. So that better to stick on to a family doctor and try to seek their support. That is my the closing statement, and thank you for giving an opportunity. Thank you, madam. Thank you, sir.
Thank you for your wonderful takeaway, doctor.
Thank
Thank,
you.
thank,
Fantastic.
thank you, Dr.
Very good.
Ravish.
Thank you, sir.
Very good.
Thank you, Dr. Ravish.
Very good.
Thank you, sir. Thank you,
Thank
sir.
you, doctor. Thank you. God bless you, doctor. God
Thank you,
bless you
sir.
on the
Thank you so
family.
much. Thank you, sir.
See, this is the only thing that we can wish for and we can pray for.
Sir, that is I'm very privileged to interact you with people like you, sir. Thank you so much, sir. Thank you so much.
God bless you, doctor. Thank you.
Good day.
Bye.
Good
Bye.
day.
Bye.